Hi, so today I'm going to do a commentary video on Symptomsky'S video about Gerd, which is gastroesophageal reflux disease, commonly known as acid reflux disease. I am a Symptomsky contractor from Kenya, and let's get into the video.
Over here would be the chest bone, the sternum. Feeling a burning sensation or pain behind this bone is referred to as heartburn. While it might be just a mild annoyance that we all experience once in a while, the gastroesophageal reflux disease is actually a major cause of this condition, but there are other dangerous causes for heartburn as well.
So Gerd ni ugonjwa enye huwa mostly ina present na heartburn, na Gerd mostly inakosiwa na acid enye iko kwa stomach ikimove back to the esophagus. So ikikosi hiyo corrosion kwa the esophagus, ndio reason utafeel ni kama uko na hiyo burning sensation enye ita present kama heartburn. But necessarily I mean ati ukiwa na heartburn uko na Gerd, but ukiwa na Gerd ita present na heartburn.
And before we get to that, let us explain where it all starts. The stomach. It is an organ capable of producing acid that is capable of digesting all sorts of foods, meat, and plants. Its walls are mainly made out of muscle tissue, and that muscle tissue can contract and relax in a synchronized way. Besides only mixing up the content being digested, it can also help push it further down the digestive tract, or it can return it back up through the esophagus in a process we usually refer to as vomiting.
Kwa hivyo Gerd tumesema ina result ama inasababishwa na acid, na hii acid usually inaproduciwa kwa tumbo. Kwa tumbo huwa ina produce an acid yenye inaitwa hydrochloric acid, yenye ni a very strong acid. So hii hydrochloric acid inasaidia ku break down chakula ama ku digest chakula yenye tunakula. But sasa ikiweza kuwa that hii acid yenye imetolewa kwa tumbo ikimove back ikuje to the esophagus na inakosio corrosion kwa esophagus, ndio reason utakuwa na hiyo heartburn na gastroesophageal reflux disease.
The acid with which this content is mixed up in the stomach is very aggressive to organic tissues. The major reason why stomach can survive and contain this acid inside of itself is because it protects its walls with a pre-epithelial protection. This pre-epithelial protection is made up by the mucus bicarbonate barrier. Mucus and bicarbonate secreted by mucus cells.
So kwa hivyo unaweza kunajiuliza kama hii acid inachoma ama inakosi hiyo corrosion kwa esophagus, how come tumbo nayo haiaffectiwi na hii acid yenye inaproduciwa na tumbo yenyewe? So tumbo huwa iko na a protective barrier. Hii protective barrier imetengenezwa na makamasi yenye ni mucus na bicarbonate yenye sasa ni a base. Unaona venye acid, tuko na acid na tuko na base. So hii base yenye ni sodium bicarbonate inafanya nini? Ina neutralize hii acid. So ina reduce, inapunguza ukali wa hii acid kwa tumbo. Na hii mucus ina protect pia, ina protect hizo walls za stomach, za tumbo from hiyo acid. But sasa utapata esophagus yetu haina hiyo protective barrier, haina hiyo makamasi na haina bicarbonate. Ndio maana hii acid ikitoka kwa tumbo na irudi ifike kwa esophagus, itachoma hiyo wall ya esophagus, itachoma hiyo tissue ya esophagus, itacause hiyo corrosion kwa sababu esophagus yetu haina protective barrier kama yenye iko kwa tumbo.
Create a pH gradient, maintaining the epithelial cell surface at the neutral pH value. In more simple terms, they are capable of reducing the acidity on the surface inside of the stomach. But what about this organ over here, the esophagus? This organ is normally not supposed to be exposed to all the acid that is in the stomach. At the junction of the esophagus and stomach, there is a circular muscle called the lower esophageal sphincter, and it helps close this opening, and therefore it prevents the acid from the stomach going upwards into the esophagus.
Kwa hivyo usually kuna kuanga na a sphincter inaitwa lower esophageal sphincter. Hii sphincter iko the lower part. Unaona sasa ukitoka kwa the esophagus unaingia kwa tumbo. So hii sphincter iko between the esophagus na tumbo, na ikicontract inafunga, ina prevent ama inazuia content yenye iko kwa tumbo na hiyo acid from kurudi to the esophagus. But now iki happen ama kukiweza kuwa that hii lower esophageal sphincter ya patient imekuwa compromised na ikakuwa insufficient, haitaweza kucontract na kufunga hiyo path yenye na lead from the esophagus to the stomach, such that contents zenye ziko kwa stomach na zenye ziko na hiyo acid ndani ya tumbo zinaweza kurudi back kwa the esophagus, yenye sasa italeta shida.
Because of that sphincter, you can lay down in your bed at night and you can be sure that the acid will not leave your stomach and end up in your throat or your mouth. But if somehow that actually does happen and the acid does leave the stomach and ends up in your esophagus, you might experience heartburn. You might even feel sour, acidic taste in your mouth or pieces of food you ate. Ultimately, you might even feel pain in the stomach area, the epigastric pain. But what causes this and what can be done about it? Before I explain this, I have to ask you something. You see, YouTube and other websites will only promote our video or suggest our video to other people suffering from gastroesophageal reflux disease if we get enough of likes and subscriptions. That's just how their algorithms work, and we notice that the videos that don't get enough of likes usually are not suggested to the audience. So you can help us help other people by liking this video or subscribing. But now back to the heart.
Kwa hivyo hii video yenye inaongelelea gastroesophageal reflux disease inaweza saidia sana watu wenye mostly wana suffer through such conditions, and through kushare na kulike hii video itasaidia sana for YouTube kupush hii content to watu wenye wako na hii shida na wenye wata benefit sana kutoka kwa hii video.
Burn. I pretty much explained that the gastroesophageal reflux disease is when the content of the stomach can get into the esophagus, primarily the acidic content of the stomach. But what about the pathophysiology and how does that happen? If there is a narrowing here at the exit of the stomach and the food cannot leave the stomach easily, then that might cause this reflux into the esophagus. But that is not the only cause of the gastroesophageal reflux disease. Pregnancy and obesity can also cause it, but primarily it is the insufficiency of the lower esophageal sphincter that causes the gastroesophageal reflux disease. As you can see, there are
Kwa hivyo nimesha explain vile insufficiency ama like shida ya the lower esophageal sphincter inaweza sababisha gastroesophageal reflux disease. But pia kuna causes zingine zenye zinaweza cause gastroesophageal reflux disease. Kwa mfano, ukiwa na narrowing ama like hiyo shimo, hiyo space ya between tumbo na the small intestine ikiwa reduced, then inamaanisha contents zenye ziko ndani ya tumbo haziwezi toka zikaendelea chini into the intestines zikakuwa expelled into outside the body. So hii narrowing ita result to content kubaki kwa tumbo, na ikibaki kwa tumbo inaweza move back up to the esophagus. Other causes ni kama maybe during pregnancy, pia unaweza pata uko na such conditions kama like heartburn na maybe Gerd.
Different and many causes for gastroesophageal reflux disease. There are also different types and consequences of this condition. Diagnosing it properly can be tricky, and conducting just one clinical test is not enough. There is a set of clinical examinations and tests which have to be performed in order to properly diagnose gastroesophageal reflux disease. Luckily, however, if the patient experiences the specific symptoms I've described, and there are no red flags, or something like that which might indicate that there is some malignant or cancerous condition, then even before these diagnostics are performed, a therapy with medication can be started. Normally, we are working with proton pump inhibitors or H2 receptor blockers, also with antacids. The proton pump inhibitors and H2 receptor blockers are basically limiting the acid production capabilities of the stomach. That means that less acid is released.
Kwa hivyo, mtu akipresent na hizi symptoms, mtu ako na heartburn, yenye inaweza kuwa maybe ni a symptom of Gerd, anaweza anzishwa na madawa za kureduce acid. So kuna 3 classes za madawa. Kuna proton pump inhibitors. Hizi na tuko na antihistamines zenye ni H2 receptor blockers. Hizi ni dawa zenye zita reduce ama zitapunguza kutengenezwa kwa hiyo hydrochloric acid. Examples za proton pump inhibitors ni kama omeprazole, esomeprazole. Examples za hizi antihistamines ni kama cimetidine, ranitidine. Pia unaweza patia mtu antacids. Hizi antacids though zitafanya nini? Zitapunguza hiyo makali ya hiyo acid yenye already ishakuwa released na iko ndani ya tumbo already ama ishapanda juu kwa the esophagus.
Into the stomach. The antacids, however, work on neutralizing the acid that was already produced. One other type of medication called sucralfate is binding to the proteins in the pre-epithelial protection of the stomach, and that way it reinforces this protective layer. So you can see that the mechanism through which these drugs help are somewhat different, actually quite different. So the patient was taking one type of medication and it didn't help. Well, maybe additional medication might help because they work differently. But also the first medication that was taken in the first place was maybe simply taken at a wrong time in a wrong situation. The antacids neutralize the acid of the stomach right away, but their effects fade quite quickly. Proton pump inhibitors require some time till they kick in, but their effects are stronger and they last longer. That is, however, if the medication is taken properly. We have to consider when and how, in what situation, and in what combination it is taken. So just taking one pill might not help. The therapy for gastroesophageal...
So hizi dawa za gastroesophageal reflux disease saa zingine huwa zinatekiwa, zinakombainiwa, maybe utapata utatake proton pump inhibitor na an antacid. Mbona? Because kuchukua hizi dawa za acid mostly za Gerd ina depend na time yenye unachukua hiyo dawa, kwa sababu utapata for example kitu kama proton pump inhibitor ina prevent ama inazuia kuproduce acid. So what if ikuwe acid ishakuwa produced? Unaona, so hiyo situation kama hiyo utanid an anti-acid. Yeah.
Esophageal reflux disease has to be planned in order to avoid further frustration and suffering for the patient. So I explained two major problems, especially for patients, but also untrained clinicians, and those were the diagnostics and therapeutic issues with the gastroesophageal reflux disease. At the end, I want to explain the third problem, and that is the red flags. Red flags that might indicate a presence of a cancerous malignant disease. These red flags include loss of body weight, anemia, and difficulty swallowing. They should never be ignored. If a patient reports,
kwa hivyo unaweza pata patient mwenye atakuja akiwa na anemia ama akiwa na reduced body weight, ame lose kgs, vitu kama hizo. So symptoms kama hizi ni very risky na zinaweza kuwa zinamaanisha maybe anaweza kuwa na cancer ama kitu kama hiyo. So anafaa kuwa looked into further na more diagnosis zinafaa kufanywa, more tests.
such symptoms, additional diagnostics are a must. Doctors and patients, we have something for you. If you're a doctor and you want to make videos like these, then go to Symptomsky.com. But if you
So hizi ni sites zenye unaweza pata more information, ama like kama wewe ni daktari na unataka ku create such videos zenye zinaweza saidia people out there. But pia kwa sasa Symptomsky iko Kenya na inaweza patikana na pia kwa lugha yetu ya Kiswahili. So yeah, you can check them out on YouTube.
you have more questions about heartburn or gastroesophageal reflux disease, then go to Symptomsky.com/help/GERD.